Been a worrying surge in COVID-19 infections over the last 2 weeks. The recorded number of deaths per day has doubled in just 2 months, while health facilities have become congested with COVID-19 patients, with close to 1,000 of them in intensive care. NTV's Seth Olale explains further why the president introduced the stringent measures.
Not many expected President Uhuru Kenyatta to take such drastic measures on COVID-19 so soon after his latest address to the nation.
I have been compelled by medical as well as empirical evidence to revise the measures that we took on March 12th of this year.
As of 21st March 2021, the confirmed number of COVID-19 cases reached 15,916 compared to 4,380 in January. COVID-19 positivity rate rose from 2.6% in January to the current 22%, meaning the infection rate has risen 10 times between January and March 2021.
Our rate of infection has gone up 10 times between January and March of 2021. Indeed, it is clear, and we have a clear indication of a new trend, that now Kenya is squarely in the grip of a third wave of this pandemic.
Out of every 10 people who test positive to the disease in Kenya, 6 are from Nairobi County, making the capital the hardest hit. But even more worrying is the rising death rate from COVID. Between January and February, the disease was claiming 3 lives, but now 7 people are dying daily, the highest number since the pandemic hit the country last year. The number of people admitted to hospital as a result of COVID-19 across the country has risen to 7,630 from 4,990 patients in March 12th, meaning in just 13 days, the admission rate increased by 52%. In addition, there are 950 COVID patients in intensive care units needing oxygen compared to under 30 people who were admitted in the facilities in the month of February.
This confirms the fact that a third wave of COVID-19 is at hand in Kenya. The positivity rate is the highest since the pandemic hit us last year. The death rate is devastating by all measures, and the stress that the pandemic is placing on our health system is unparalleled.
According to our health experts, the third wave began to gain momentum at the beginning of March 2021 and is expected to peak in the next 30 days, with more than 2,500 to 3,000 cases expected to be reported daily. The peak is expected to flatten by mid-May 2021. Seth Olale, NTV.